Good afternoon, everybody, and welcome to the session where we are covering reallocated road space for walking, cycling and wheeling during COVID-19. It's a long title, but we felt it needed to say exactly what we mean on the tin as to what we are here to talk about. Thus, it's maybe not the snappiest, but that's exactly what we're here for today. My name's Irene Beautyman. I work at the Improvement Service, which is an organisation that works across councils in Scotland, helping and assisting them with their work in delivering on Scotland's outcomes. I'll give you a little bit of an introduction to what we're doing today and then the actual topics that we're covering. And then I'll be delighted to hand over to our speakers today, who are Daisy Nazarian, who will give us a little wave. Daisy, wave for us. Hi. So Daisy is Director of Urbanism at SUSTRANS. Then we have Councillor Anna Richardson, who's the City Convenor of Sustainability and Carbon Reduction at Glasgow City Council. Hi, Anna. And then last but not least, we'll have Councillor Leslie McInnes, who's Transport and Environmental Convenor at City of Edinburgh Council. Hi, Leslie. So you'll have realised by now, I hope, that while you're taking part in a webinar, you won't be up on the screen. It'll just be the four of ourselves as the speakers that you'll be able to see. And likewise, as we have over the 500 limit signed up today, nor will anyone other than the speakers be able to talk, because we simply could not manage that kind of conversation. However, on the right-hand side of your screen, there is a box around GoToWebinar, and at the sort of bottom third of that, there's a little thing saying chat. If you wish to submit some questions in there, then please do feel free. What I will say is, I suspect with four of us, we'll have time for 2-3 questions. And there's 500 people or more listening and submitting things. So please do not be disappointed if we don't get to your question. They will be recorded. We will have them written down. And Daisy has certainly said that from SUSTRANS' point of view, they would appreciate a look through them. However, we're here to talk about a national thing within Scotland and what is happening and rolling that out across Scotland. So if you have a really local point or a local question about your specific area and a particular area that you feel there's an issue around, say, social distancing, then please use your own resource to submit that into your council or your local councillor, because that's not the level that we would be able to assist with, and it would definitely be of more value for you to submit it directly to them than to ourselves. So our objective today is really, it began a few weeks ago with conversations happening across Scotland and being aware of them around people moving and cycling and wheeling around Scotland during a requirement that we also keep 2 metres apart from each other, and that there are areas throughout Scotland that are finding that at times difficult without having to step into the road and not feel an element of safety in being able to walk and cycle if you're stepping into a road where there are still cars moving around. So it was becoming a growing issue, particularly when you consider that we have key workers moving around, getting to work, and at times pressure points where they're simply not managing to keep that 2 metre distance. And that's a real issue for our maintaining all the services that we are all sitting at home, mostly appreciating, not just NHS staff, but all of those going to work and to shops and to enable us to keep going from our houses at the moment. So that was a growing topic for ourselves, and for myself working at the Improvement Service, a growing issue around a certain inequality with that, because those that cannot use a car are most definitely being pushed into having to use pavements and cycling and whatever other means to get around. There being an obvious issue at the moment with just how safe public transport can be. But even if you're able to use public transport, you tend to have to walk or cycle in order to get to that public transport as well. So that was being seen as quite a short-term issue, insofar as it was while we were all being asked to socially distance, and we didn't really know how long that was going to last. However, we're all aware now that it's being highlighted that could last till the end of the year. And at the same time, we could have a relaxation of that lockdown that we're under, with other businesses opening up, construction, other shops being allowed to open up, but are still being asked to keep 2 metres apart. So that begins to turn what is a short-term issue into a medium-term issue, where we don't know quite how long that is going to carry on for. So with that in mind, then, it really started to become figural, and we started to set up this session. I don't want to say too much more beyond that. There's an element here about why are we looking to reallocate roads. It's important for me that it comes across absolutely unequivocally that this is about dealing with the outputs of a pandemic. It's mitigating the impact of what we're being asked to do. That isn't easy for any of us, and we're all doing our best around that. And this is another level of that, and another level of an ask around all of us to do that. There are actors, though, within making that happen, within creating more space for people to be able to move and cycle around. And the key actors are the users, everybody who's out there, and that includes ourselves and all of you listening in. And I can only assume the fact that you are listening in means that you're aware and thinking about that as a user as well. There's also those that, for want of a better way, own the roads. That comes to councils and their involvement in this. And then there's activators who are there wanting to contribute and do something. So that really shapes what we have today, in that we have Daisy here from SUSTRANS, who is one of those activators within the environment and that third sector. And then we have Glasgow and Edinburgh joining us as councils, and the fact that they are the organisation that sits there as that kind of enabler that can make this happen. I'm very aware that is covering our 2 cities in Scotland rather than any of our less rural or smaller towns. However, the feeling that we have been getting is this is an issue for everywhere. This is an issue for rural areas, and it's an issue for neighbourhoods. And while I live in Edinburgh, I haven't been in my city centre in 5 weeks. I haven't seen it. I'm living in a neighbourhood and what I count as my own village, really. And I am still experiencing day in and day out pinch points of where there's an issue around that space that is only going to end up getting worse. So the other final thing before I pass over to Daisy that I wanted to just say is the reason we've opened this out as well. As I say, I work in an organisation that helps councils in the work that they do. But I also work in that organisation about working around place, and places are made up of everybody that is in that place. So that's councils who own and invest in that area, it's the users, and it's all of the other sectors that are contributing to that place. So it was very important, they felt, to open this whole conversation out and have everybody's input into that. At the end of today, we will be sending out a recording of everything. So if at any point you're having a difficulty with being online, pop something on that chat, and we do have some helpful background help with the tech, and we will, I hope, be able to sort it. But if not, do not worry, because we will send you out a recording. That'll be done in a couple of days, and we will look at that point about whether there's any sort of something coming through today about the need for any questions, a little bit of feedback from yourself, and whether there's a need for any temporary sort of network to keep this conversation going around the vast resource that there is out there, and thoughts and ideas and what can be done. But I emphasise again, that's at a high level. If you've got more local thinking, please submit that locally where it can be of maximum value. So with that then, where we are today is very fortunate, because 2 days ago in our Parliament we had an announcement by Michael Matheson, who's the Minister in charge of Transport, around what would be happening given that there had been increasing conversations about the issues with roads and space for people to get around safely. He announced a new initiative called the Spaces for People initiative, and that it would be SUSTRANS in Scotland that would be the enablers and facilitators of that initiative. So I think a clear message we want today is to explain what that initiative is, so that all councils can be aware and clear on what is happening, and that everybody that's using place can know a little bit more of the detail of what follows ahead. So I'll pass over to Daisy to give us a bit more of an explanation around that and the background for SUSTRANS involvement in that. Thank you, Daisy. I'll hand over to you.
Thanks, Irene. Thanks so much. And I love what you said about neighborhoods because, I live in the city centre of Edinburgh in a small flat. So I apologize in advance if you hear my little kids are running around and screaming. They're just off homeschool just now. But, I live in a neighborhood now in the city centre of Edinburgh because, we're all living in this 20-minute kind of enforced area. And I found that really interesting how that's changed my own perception of what is around me. So I like that you've picked up that point about neighborhood. Just wanted to say that. And yes, I will talk about the detail about the fund, but I hope you don't mind, Irene, if I just go into a little bit more about the context and the why this needs, why this this is happening as well. Because for me, I mean, we live in really strange times, don't we? If life were normal, I'd be packing my bags today because I was meant to be going home to India tomorrow to meet my family. It's been 2 years since I've seen them, my friends and family. And I've been having quite a wobble this morning about that. I've spoken to a colleague of mine and I was in tears. So, that's the world we're living in. This isn't some kind of, oh, this is a transport agenda that we want to, take forward. This is very much about people's lives. Myself, I'm feeling the impact of what's going on in my own personal life. We're connecting with each other, my family, friends, colleagues through a screen. There's 500 of us, right now speaking to each other. I find that incredible. And outside, in our streets, it's just eerie. It's quite abandoned. It feels really strange. And I think our relationship with each other as human beings, with the built environment, with the natural environment, I think it's completely redefined by this pandemic that is happening. And I think the way you said that this is a response to the pandemic, I don't want anyone to think that the work that we're doing in SUSTRANS or collectively is anything other than that. This is a response to a public health crisis. Because my kids talk about when the virus is over, when things go back to normal, but what does normal mean? And I think the future seems uncertain, so we need to acknowledge that many parts of the normal that we talked about was broken. Normal was a climate crisis. So again, the things that we're doing right now, for me, has to be something that when we're looking at the three horizons, which is short, medium, and long term, we are addressing the bigger picture of that as well. In SUSTRANS, as you can imagine, the past couple of weeks, we've been talking about how transport, what does it mean for transport? What does it mean for the future of transport? Because as the lockdown loosens, and we've seen this in China, with Wuhan, when the 73-day lockdown was lifted, people rightly so, I mean, justifiably feel the car is their safe place and that's the safest way to travel. And we have a real danger here that could happen if we don't start to address some of those issues right now. So as I said, as you said, we've got those three horizons that we're looking at. So the right now, which is during the period of restrictions, we have to make sure that people who are taking those necessary trips have to be safe. Those who are exercising have to be safe. The medium term, as we come out of the lockdown, people who enjoyed rediscovering their neighborhoods, enjoyed rediscovering their bikes, getting out and about. How do we make sure that they have a real choice to keep up that activity and to keep up that mode of whatever they've, if they've shifted modes of travel? And then for the longer term, which is not, I understand what we're talking about today, but it is a real opportunity to understand what kind of change we want in our streets, in our cities, our neighborhoods. And cities across the world are doing that. A couple of quick examples. In California, city of Oakland, they've closed 74 miles of roads, which is 10% of roads in their city, through traffic, so people can walk and wheel in safety. Vienna has created 9 temporary meeting zones, which I love. I like the idea that people come together, even though they're socially distant. In Berlin and Bogota, they've given away road space to create a complete cycling infrastructure. So in Scotland as well, I mean, we've seen over the past few weeks this momentum building up, this drumbeat on social media, and I'm sure, Leslie, Anna, you've had scores of emails and tweets coming your way as well. And I think as a response to that, as you said, on Tuesday, in a statement to Parliament, the Cabinet Secretary announced a new £10 million programme. And that was specifically to put in place temporary active travel infrastructure to respond to increasing numbers of people choosing to walk, wheel, and cycle during the public health emergency. So again, he was very clear that this is in response to public health emergency. And the program is called Spaces for Everyone, as he said. And you hear from Anna and Leslie about specific plans in Glasgow and Edinburgh. But in SUSTRANS Scotland, we've been working around the clock over the past week to ensure that the process by which this fund can be accessed and looked at and taken forward is as light touch as possible, because this is again something that has to be really quick and easy to deliver, and has to be quick for everybody within the delivery of the life cycle of the project. So very quick outline of what this is about. There's a website, SUSTRANS website, there's a landing page right now. It gives you some information. It's going to be updated with further information, but I'll give you a flavor of that right now. And by either this evening or tomorrow, it's going to be updated on the website. So what is the fund? Very quickly, it's, as I said, a temporary infrastructure program. It offers funding, but it also offers funding and support to make it safer for people to choose to walk or cycle. Again, we keep talking about this is about a response to COVID-19. The program offers funding and support. It's to enable partners to implement measures focused on protecting public health, supporting physical distancing, and to prevent a second wave of the outbreak. So again, very clear that this is transport and public health completely interlinked. Who can apply? It's open to statutory bodies, and as we can imagine, we're anticipating that most of the applications come from planning and roads authorities. But we welcome submissions from other statutory bodies like Scottish Canals, NHS health boards, RTPIs, partnership with local authorities. What can you apply for? You can apply for up to 100% funding, so there's no match requirement with this money. And if needed, access additional support, as I said. And this is across the various stages of the delivery cycle. So, we want to make sure that even the temporary measures that are put in place are inclusive and they meet the needs of different groups of people. So some examples of the kind of support, there's procurement, there's engagement, online engagement, for example, communications, design, implementation, for example, if you want to plan the network, and civil engineering, urban design, landscape architecture, contract management, support provided for monitoring and evaluation, because I think the way we collect data and the way we use data is going to be very, very interesting going forward. Signposting and referral. So Scottish Government, Transport Scotland are very, very keen that this is a one-team effort. So local, national government and ourselves coming together, and they will help connect us with key contacts in, for example, Mobility and Access Committee in Scotland, the MACS, and Public Health Scotland. So if you need a clinician support, as Anna, your team were saying the other day, can we have clinical support to say, how do we face the challenge of a second wave, for example? That would be really useful for us. What kind of projects? Again, it's projects that protect public health, immediate delivery. For example, journeys to hospitals and from, to health services, shops, pharmacies, schools for key workers, journeys for recommended exercise, for example, neighborhoods and local parks. And again, just very quickly, some examples of what kind of interventions we're suggesting, but again, completely open for ideas to come through. Selective road closures, reallocation for wider footways, so widening your pavements, reallocation space for cycle tracks, reallocating parking and loading where it is relevant and necessary. Reduce speed limits, for example, traffic calming measures, communication. So there's a whole host of support that we can provide, and we can work with you to make happen. Scottish Government have written a letter from the Cabinet Secretary to all local authorities, the chief executives, and within that letter he's provided guidance on the TTRO process and the changes that they've made, or the things that they have enhanced within that process to help local authorities make things go quicker. As I said, the information will be up on the website and will be updated as well. So just to conclude, I think for me, what this pandemic has highlighted is a crossover between the quality of our spaces, public health, economy, transport, education, air quality, social justice. It's all come together. And Leslie knows this, with my secondment in Edinburgh Council, my constant mantra of collaboration. And we have to take a collective, proactive approach to use emergency measures, maybe in the medium to long term, to address the vital societal challenges if we can, and shape a new world rather than returning to the old old normal as we know it. I'll stop there. I'm very happy to take questions when they come in, Irene. So thank you.
Lovely, thank you, Daisy. I think a real thing coming through there is about what I didn't mention, that prevention of a second wave, making it all the more important that we're into a medium term here of what could happen when there's more people out and moving around. And then likewise, I'm hearing that my connection has dropped. I shall carry on regardless at the moment until I'm told by Christopher to do something else. And then likewise, what would we be doing, joining things together, the benefits of local and national, and that whole aspect around queuing is absolutely crucial. Hello.
Irene,
hello. I kept talking. I just kept talking.
we have you on the phone, but your webcam is dropped, so you can still keep talking, but at the moment people can't see you.
Okay. That's fine then. Okay, I shall keep talking nevertheless. Okay, so you can't see me. That's probably a good thing. I shall just carry on talking nevertheless. Yes, so what you were saying about local and national coming together, so important that we have an approach. And for myself, working with all 32 councils, I want to see that every area, every town, every pinch point in Scotland is getting that equal chance to take advantage of what's been announced and what you'll be facilitating. And yes, what I was saying about, we've already seen the pressure on pavements and people are queuing simply for myself at the top of the road to go to the bank. That is only going to get worse as other businesses are opening out. And that's an issue for business as well, because we want those businesses to be able to get going and recover as quickly as possible. But that's only going to happen if people are feeling safe to actually go out and use those businesses. So thank you, Daisy. I'm now going to hand over to Anna Richardson from Glasgow City Council, and she'll be able to give us some insight on what's happening there in the lead up to and now as a result of the initiative that's been launched. Over to you, Anna.
Thank you, Irene. So I'm just going to talk briefly a little bit about the experiences we've had here in Glasgow. It's been quite an interesting couple of weeks, and certainly things have moved at a pace that we'd never have imagined before. Those of you that know Glasgow will understand that we already have high ambitions around climate change, around active travel. We know the reasons that walking and cycling are important and need to be promoted as much as possible. We've been doing long-term strategy work. We've got multi-million projects on the go to improve our transport systems. All that planning was happening, but what we hadn't been planning for was a pandemic that would require long-term social distancing. That was just not something that we'd thought about. We often talk about density being a positive thing around transport, and suddenly it's seen as the enemy in terms of public health. So we've had to think about how we have a very fast response to do a lot of the things we want to do anyway, but perhaps slightly differently, and to talk about projects in weeks instead of years, which I think from a transport perspective is an absolute change for all of us. So I'll just talk a little bit about some of the things that we've learnt over the past couple of weeks. And as I said, it's been a real, very speedy change for all of us. So I think we need to understand why we need an emergency response, and what seemed absolutely crucial from the beginning in Glasgow was that we were all working towards that same goal. So understanding why we need to make these changes and why we need to make them at this pace was absolutely fundamental, so that we could pull together in collaboration, as Daisy said, is absolutely crucial. So we need to see cycling as a mainstream mode of transport, as well as obviously part of people's everyday exercise. And it's only by putting in things like pop-up bike lanes that we can really create infrastructure to enable that for as many people as possible. And we need to think about sustainable transport as an equalities issue. I've got more than 50% of the households in the city that I represent without access to a car. So while we talk about people perhaps making choices about private cars, most of the people in Glasgow don't have that option. So we need to make as many safe options available to them as possible through changing the way public transport is delivered, but also in ensuring that they can walk and cycle if they want to. So I think that's really important. And that needs to happen now, because a lot of people, perhaps without access to a vehicle, are key workers. They are doing jobs. They're out there already. They're certainly not all teleconferencing from the safety of their homes. So we need to be aware that every day that we don't act is a day that we're not tackling that inequality that is inbuilt in our city at the moment. And secondly, we need to be thinking about the safety of people when they are in their neighbourhoods. I think it's great to hear the words neighbourhoods come up so much already. Queuing on pavements, moving around, going for a walk, People are already doing this, so we need to be responding to the needs that they've got. I'm also very conscious, because I've got 3 children in my house, that at some point schools will need to return, and we're going to create significant pressure points on a lot of our pavements at 9 and at 3 as a result, especially if we're expecting parents to be very conscious of how they pick up and to socially distance during that. So we need to be creating more space in our town centres and our high streets, because we need to ensure that people can do the business they need to do every day safe from COVID transmission. And I think what this shows, and what a lot of us knew already, is that many of our streets have not been fit for purpose for many years. They do not give the space that we need for the number of pedestrians we have. But what we haven't had before is this sense of an immediate threat to health that a transmission of this virus can cause from one day to the next. I think that is perhaps what is shifting that narrative around how we need to move quickly. And then, of course, in the medium term, we are storing up problems for ourselves if we don't work now to minimise the risk of air quality deteriorating or congestion and increased traffic, making our streets less safe. The last thing we want is for people who now feel that they can walk and cycle more to perhaps put themselves at risk because of high-speed traffic, for example. That's something we have to make sure that we manage now. So the direction we got from the Cabinet Secretary this week has been fantastic. Not only money in the way of the funding pot, but a very clear message that we need to be confident as local authorities, and we need to feel that we can make bold changes and to treat this as a genuine emergency. So in Glasgow, we have spent the last week trying to identify a couple of locations that are quick wins, the ones that can bring maximum benefit but with minimal disruption to those who are perhaps moving around the city at the moment. And we felt it was really important to do that, to give people a sense that there is momentum here, that we are moving and that we're willing to act really quickly. So one that we are doing is closing a street beside Kelvin Grove Park, which is a very busy park, to just create a little bit more space for people who will be using that, either to commute through or to walk around. And alongside the River Clyde, we are going to be putting more space for cycling to take some of the pressure off what's a very, very busy shared path at the moment. It's too busy at the moment. It's not safe from a physical distancing perspective at the moment. And I think there's a real symbolism there in taking that first step. I do believe this is going to be the hardest one. If we get these on the ground, we'll show what's possible, and then we'll be able to take a little bit of time to breathe, to look at our long list of sites, which of course has plenty of challenges in it. Some of those will be difficult, but that doesn't mean that we won't try our best. And also, I think the other thing that's important here is to accept that some of this work will be a wee bit rough and ready. Of course, we'll have a lot of guidance and support from SUSTRANS and others, but this won't be perfect in terms of infrastructure. Sometimes it won't quite work. Perhaps it's not on exactly the correct street. Perhaps we think it's going to be ideal, but it isn't suitable in terms of accessibility for all. And I think that's okay. I don't think we see any of that as failure. I think we see that as learning on the ground in real time, and how valuable that is going to be for all of us. And I think we also need to see temporary measures as a strength, because as a few people have already said, I think Daisy especially, we don't know what the new normal is going to look like. We can build in physical distancing where people used to shop and the ways in which people used to move. They may well have changed their habits, and that might happen for months to come. So the things that we think are right now might be right for now, but won't be right by September. So let's use the word temporary as a strength. Let's use it to say that this means that we can remain nimble and we can continue to respond as things change, and as no doubt we think about looking towards a second wave or beyond. And the last thing really I want to emphasise is that this work is vitally important. I don't think anybody could disagree with how essential it is that we do this. And to an extent, it's pretty obvious what we need to do. It's certainly it's very easy to say, well, this is all we need to do. We just need to create more space, and we need to do it quickly. And we can all agree on that, but that doesn't make it easy. And that's okay. It's okay that it's hard. The barriers that have always been there around our street layouts, around our concerns about how the public might react to change, about accessibility for all groups in our society, none of those challenges have gone away in 2 weeks, and that's okay. I think we need to accept that. I think we need to be very open about learning from each other. I think we should take best practice wherever we can find it. And I think we need to remember that while political support is crucial, and certainly it feels as though it's very important at the beginning of this process to make these initiatives a success, it's not going to happen without a huge amount of effort and a huge amount of skill and talent behind the scenes. We simply cannot deliver these without all of the skills that we have within our local authorities and our third sector. And I just don't think I can emphasise enough the way that all of the council officers involved in this have gone above and beyond. They have achieved things in a couple of weeks that would have been laughed out the door under normal circumstances. It's incredible the way that people have redirected their efforts, and I think it's really important to acknowledge everybody that isn't seen on the screen today that has made this happen for all of us. So I'm just going to finish by saying that I didn't expect this to be the transport priority that we would face in 2020, but here we are. It is going to be hard, but we have so much to gain from doing it. And I think we also have a great deal of privilege in being in jobs that enable us to make a contribution towards the nation's response to coronavirus. Many people feel helpless. Well, we have got a job that we can do, but we also have a responsibility to live up to that and to do everything that are within our powers to do what we can to combat COVID-19. So I'll just leave it there. Thank you, Irene.
Lovely, thank you, Anna. And I think your messages there around certainly the moving quickly in the Parliament, the Minister was asked how quickly did he mean, and he said in a couple of weeks, and I thought, wow. And then for both of your authorities, you've been moving faster than that. So it does show that we're all rising to the circumstances that we're in today, and being able to do things differently because of the response and the fact that it's a public health issue that we're dealing with. And also your reference to there being more to do, that that these are opening changes and there's still more changes to be made, and it's just getting something started and getting going. I would imagine for both of your councils and for all other councils across Scotland is start something and then carry on. This is going to be an iterative process as well of learning where things are helping most and perhaps where they aren't. So very thankful for your insight on that. I shall pass now to Leslie to explain what's happening in context with Edinburgh, and really you get that ending kind of point, Leslie. So I'll leave you with that pressure.
One of the problems of coming in at the tail end of the agenda is that you've often covered, all three of you have covered an enormous amount of what I would have said, which actually I think is quite hopeful for the future, because it does indicate a degree of us moving together forward in the same direction together. I'm very conscious that the two local authority representatives on here in the shape of Anna and myself, of course, represent two of the biggest cities in Scotland. And there will be other pressures, particularly in rural areas, in smaller towns. But I hope that some of the stuff that we are doing and talking about is relevant, is genuinely relevant to those pinch points that you find in any society. Obviously, as cities, I think we've moved quite quickly before this pandemic hit around active travel, recognising the fact that we have large parts of our population, as Anna was saying, we're in exactly the same boat in Edinburgh. Large parts of our population do not have cars. They rely on public transport and they rely on walking and cycling to get around in general terms, probably with an occasional taxi trip thrown in. So how do we respond to that as a society? If we look at what's happening in Wuhan and the fears a lot of us who are working in transport have, that we see a kind of pendulum swing back to some of the difficult habits that we've had as society before, that we're beginning to make progress around. Will we see an increase in car use, increase in congestion, the economic cost of that, the health cost of that above all else? I mean, Anna was mentioning there the air pollution. That's absolutely something we're looking at. Citywide low emission zone that was being planned long before this came about. If we see a rise up in terms of understandable car use in cities and in towns, because people are scared of public transport, they're looking for that safety and security of being inside their own car, inside their own bubble. We're turning the clock back. And that's one of my great fears as we emerge out of this. So really what came forward from the Cabinet Secretary on Tuesday, and that we've been able to respond to as two big cities, is very welcome to me, because it's actually part of a long continuum. It's a continuum that has been pushed forward very quickly by the circumstances, the dreadful circumstances that we're all living under at the moment. But what it has done is focused enormously the attention on the kind of tools that we have as a society at our fingertips if we choose to use them. What I think we're seeing in both Glasgow and Edinburgh is that we're choosing to use them. We're choosing to use the powers that have come forward through the Cabinet Secretary's statement, through the funding that's available, and through all the expertise that already sits in Scotland that allows us to be able to respond so fast with what we hope will be broadly correct measures. I think Anna's point about, some of it might be a little bit rough at the edges is absolutely true. It's something, managing people's expectations around what we're able to achieve, particularly in large urban settings like Glasgow and Edinburgh. I mean, I sometimes quake at the fact that we've got, over 1,500 kilometres of roads and over 2,000 kilometres of footways to manage in our city. I hate to think of what the numbers are like in Glasgow, but I think they'll be even bigger. So you're trying to manage all of that, all of the individual pinch points that people in their smaller neighbourhoods, in their smaller horizons at the moment, are feeling real concern about. How do we respond to all of that? So our actions have been quite immediate in Edinburgh. We immediately looked at closing off 3 roads, specifically with the aim of helping along safe exercise, providing space to allow that to happen. One of them, for example, is Silverhours Road, which leads down to one of our foreshore locations, which has proved very popular. Do we want people to drive there? No, we don't. We want it to be available for local residents to exercise and to get there, or for people to get there by bike and to exercise that way too. So that was a quick and easy option for us to take, and that's the case across another couple of locations as well. But the task I set officers, and there was a few bits of swearing going on in homes across Edinburgh when I was talking to some of our officers, because the challenge that we had to put forward was, well, how do we do that, and how do we do it really quickly? So all of those will be in place by the end of Sunday. But the momentum has to keep moving forward, because we're dealing with a really ever-present threat at the moment. The public clamour for action has been enormous. We've seen it on social media. I've seen it in my inbox. I'm sure Anna's the same. I'm sure that both of you in your roles have been the same too. There is an enormous amount of fear out there. Fear that we're not responding to the pandemic, fear that we're not taking the actions that will allow people to feel safer and more secure as they begin to go about their business, whether it's currently for daily exercise or specifically for key essential workers, as you were mentioning earlier on right at the beginning, Irene. But also fear as we go into the transition period too, because as life opens up, we run the risk of ignoring dangers. We run the risk of people just reverting back to old behaviours. We're beginning to see it speeding cars through cities. It's a serious issue. When the constraints of normal behaviour are not there, we're seeing behaviours change. How do we make sure that that doesn't happen? Edinburgh has got a 20-mile-per-hour speed limit across 80% of its roads. How do we stop that developing into a 40-mile-per-hour speed limit while everybody thinks it's a racetrack? There are a lot of things in there that are demanding action on the part of local authorities, and where we can provide a degree of safety and security for people as they go about their business, both now and in the transition period. So our next set of actions that are likely to follow in the course of the next couple of weeks will be specifically to look at widened footpaths where we've got those pinch points and temporary segregated cycle lanes. Now, will we be able to cover everywhere we want to in the city? Not in the first couple of weeks. But we will certainly, I hope that it will be taken as a very clear signal of intent around providing that security for residents in Edinburgh, but also a clear intent that we understand that walking and cycling has taken, and wheeling I should also add in, has taken a new role in society. I sit on a main road right on the very edge of the south side of Edinburgh. That's where my home is. I've got a couple of big windows that I sit at when I'm working. And I am seeing now people passing in numbers, heading towards a SUSTRANS path that's just a little bit further down from where I live. People are heading down by bike and by walking. People I've never seen before, in numbers I've never seen before. They're doing it on a Tuesday afternoon. They're doing it on a Wednesday evening. They're doing it at the weekends. And these are people that I've not seen doing that. You get to know your neighbourhood relatively well. These are not familiar faces. So people are suddenly waking up to actually that hour's worth of essential exercise is a good thing. So how do we take that and translate that into the new normal? When the schools start to open, how do we encourage people to say, actually, I'm not going to return to the car school run. I'm going to continue to have somewhere in my life the opportunity that this has presented to us in terms of renewed family time out doing something active, getting around in terms of exercise for those who are not in families, in terms of walking and cycling. So there's an enormous amount of positivity developing through this crisis, which I think we need to understand and to encourage as we go through that transition into recovery. Having said that, I think I'm going to touch on the politics of all of this, if that's okay. I'm not talking here politics with a big P, I'm not talking about party politics, but I'm talking about the sense that some people have that we might be trying to take advantage of this pandemic. I think it's been clear from all three previous contributors, and I hope from myself as well, that that is not part of the thinking. Part of the thinking is that our response right now to the serious situation that we're in at the moment has got a set of predecessors. We've done a lot of the thinking already. It's an acceleration in the face of this threat. But is actually, and the fact that we've done all that thinking about the value of active travel, the benefit of reducing pollution, the benefit of reducing congestion by switching from individual car use to public transport and to active travel, all of that thinking's already been done, and that's what's allowing us to respond so quickly. So how do we then depend upon that? How do we then, as a society, go forward and say, well, actually, this is what our new normal wants to look like? Well, of course, that's part of bringing thought in. I mean, I put out a thing on Twitter last night saying, if you've got any ideas for what you want to have happen in Edinburgh, write to me. I put my address out there. I've already had some useful, solid, valuable suggestions coming in that we can build on. I'm sure it's probably much the same thing for yourself, Anna. And so that kind of opening up of the conversation beyond the groups that already contribute. We already have really good relationships with people who represent people who want to see increased walking, people who want to see increased cycling and all the facility and infrastructure that goes with it. The people we are hearing from now don't naturally fall into those groups. And that means that I think there'll be a greater acceptance of active travel within society. There'll be a greater recognition of the real positive benefit that it can deliver to us right now and going further forward. And that is something that we have to work with really strongly, because it's a lost opportunity if we don't. Now, I want to place this very firmly against our climate change challenge. Edinburgh set a 2030 sustainability goals for ourselves. I know Glasgow's in exactly the same time frame in terms of their thinking. We need to move really quickly. And what this pandemic has shown to me is it's shone a spotlight on that. It's shone a spotlight on our methods of getting towards those goals, and more importantly, the need for us to address those goals. And we do it partly through transport. I've already started talking to my political colleagues and to officers about economic recovery. Transport, how we move freight and people around our cities, has to be a fundamental plank of any thinking around economic recovery. It can't be left to the side. We can't just deal with it. Well, we've got cars, we've got lorries, we can't deal with that. We've got to grasp the nettle and say, what do we need for that new normal? Not just a swing back to the old methods. And that's going to put pressure on small businesses, on retail businesses, for example. It's going to put pressure on other types of businesses inside the city. And we've got to find a way to support them through adjustments that they will have to make, some of which will probably feel like they're being imposed, but others will be a response to the situation that those businesses find themselves in. So there's a lot of cross-functional thinking that has to go on here. And if we don't do that, both in terms of our consideration of transport and active travel in urban, rural, small town settings, if we don't bring that together, if we don't bring together the business recovery and transport, if we don't look at what's happening around our bus network, for example, and public transport, then we will have lost that opportunity to provide a really coherent, coordinated response to this particular crisis. And I think it's our duty to do it. I'll finish there. Thank you.
Thank you, Leslie. What you covered there actually responds to a lot of the questions that are coming in about we can't help ourselves. We do go into the long term, and there's so much talk about a new normal. So I think it's worth having that thought, and what we do now informs how we move into that new normal. That's so valid, despite the fact that what we're here and discussing today is much more short and medium term. But that short and medium term still feeds into that, because it's still about inequalities. There's people who don't own a car not being able to make a choice on how they get to work or get to a shop or do the exercise should be local anyway. And there's sort of that impact on local businesses. It's already having that broader impact on a whole system recovery that is going to have to happen. What we do now. It was interesting what you said. We'd had a question about, how did you decide what to bring in? And you said, Leslie, that it was stuff that you were already inputting and thinking about because there's been work done on this already. Anna, is that something for yourself as well, that you were able to look at schemes that were already being looked at anyway? And most councils across Scotland will have things that they would be able to look at and adapt and work with, rather than inventing a new wheel. What's your thoughts, Anna? And then I'll come to you, Daisy, because I know that you had a comment to make there.
Yeah, funnily enough, neither of these are schemes that we're particularly going to go forward. They are quite direct responses to the situation we find ourselves in at the moment. The Clyde Street and Broomielaw project that we're just drawing up at the moment is directly adjacent to an existing cycle route that it's one of the most popular and busy routes through the city. And what we find is that there just isn't capacity there anymore. So there's quite a wide road, so there is space that we can take. So that isn't one that we were going to do anyway necessarily, although in the longer term through city centre regeneration it would have been. But certainly we've got a lot of projects that are stacked up at the moment that were construction happening we would be digging right now, and obviously we can't. So we will need to consider whether some of those are actually key routes that we need to get on the ground as essential pieces of work under this, or whether actually we've got slightly shifted priorities at the moment because people are moving in a different way. So we're trying to stay quite open and responsive at the moment to that.
Can I just jump in and clarify something, Irene? Sorry, just before we go on to Dee's contribution. When I was talking about work that we'd already done, I was really talking about the sort of strategic approach, the broad policy approach that we'd had, rather than specific schemes. Because like Hannah, we've looked at fresh areas because we're trying to see what's actually happening now and to provide that safe exercise space primarily. But what we'll go on to do will be more reflective of previous policies. Sorry, Daisy.
Okay, so there's that. Yeah, no, there is that aspect, isn't there? The schemes being worked up were all about getting us into city centres and town centres, but we're all living in our neighbourhoods. We're not going near those places at the moment. Daisy, on you go.
Well, just a quick one. I mean, first of all, to pick up on this point of what projects are being taken forward, it's not even projects, it's like what measures are being taken forward. And I just wanted to say, it's been amazing working with the officers at Edinburgh and Glasgow, over the past few weeks, and also other local authorities. I've been speaking to different local authorities who are interested in looking at these, looking at what can be done. And one of the first things that you would naturally do is go back to what's already there on the drawing table and look at what can be taken forward quicker. But then very quickly, when you put the layer of where are the hot spots, because that's the first question, where are the hot spots? Where is it dangerous right now? Where is it? That's when you start to say, actually, we can take the learning from how this was put in place, or what the thinking was going into that, but this is where it needs to be done. So I think there has been some amazing conversations across with individual local authorities, and there was a collaborative discussion that we had with 3 local authorities, which I thought it was just amazing to see that kind of positive collaboration, that we don't have time to go away, reinvent the wheel. We need to make sure that it's consistent, whatever's put on the ground is consistent. And to me, that's going to be one of the things going forward, is that kind of coming together of not just national, local and the third sector, but also within the local authorities and partners, this opportunity to really come together and collaborate and do something meaningful. And Leslie, as you were saying, that then speaks to how we tackle climate change. That would have been set then, that kind of working pattern, that working process.
we've had a few statements in from business improvement districts saying, you know, that they're so supportive. This is the kind of action that they need in order to get opened up safely and to have people actually wanting to visit their areas and offering support as well. I'm aware we also have a lot of community councils online and a few questions simply asking what can they do to help, and I wondered what views were on that. I've already highlighted about feeding in locally, about local pinch points, but what else do the panel feel?
I think there's, sorry, I just jumped in there, Anna, but I think there's something useful that community councils can do, which is to facilitate the conversation. Not only about in terms of just getting the information out about a local action that's happening in their particular area, but also to try and garner a feel for what's happening in the local area. I think often community councils are ignored as a really important part of the democratic process because they can act as a gathering of information in a very helpful way. And if they can feed that into us, we can find a way to address as many of the problems as possible. One of the things I would say though, and this is perhaps particularly relevant in a big city setting, as Anna and I do, have to deal with, is that we will not be able to please everybody all of the time. So there may be, somebody may understand that there's a tiny narrow bit of pavement in their area that they've got particular concern about. But if we know that actually the passage of people along that pavement, it's not actually of sufficient number that it requires us to do anything at this point, we'll probably put that to one side in favour of those who we can have the biggest bang for our buck, so to speak, in terms of action. Because we can't cover whole cities in that way. So I think there will need to be some understanding that we'll be doing our best across as much as possible, but we won't be able to meet everybody's needs. So managing expectations is something that community councils could really help us with.
Anna,
yeah, if I can,
to that?
Yeah, please. I think a lot of what Leslie says, and on top of that, just how powerful it can be hearing the voice of a community council. As you know, it's not enough just to write to your councillors, contact your community councils as well, and get them to write to all the local councillors so that it's clear that there's that interest. And I think sometimes we don't talk about the elephant in the room around designing streets, that to give space to anything, you have to take it away from somewhere else. And in this case, if we're looking at the high street, certainly the local centres in Glasgow, that's going to mean taking away parking spaces so that we can make the pavement wide enough for people to safely queue outside those businesses. So there needs to be conversations there between the residents, between the business owners, about the community council even helping where they have those connections into the business improvement districts as well, just to say, well, if you want people to come to your shop, people are probably coming on foot, or if they're driving, they may have to park a little bit further away, but then they will be able to queue safely, and that will make them come to your street rather than another one that perhaps is less safe. And so perhaps there's a really good opportunity there to be talking about the issues around parking and around how much space there is for traffic and how much space there is for walking, cycling and wheeling, and how we can all have that conversation perhaps in a different sphere than we have had in the past, where sometimes it was confrontational, sometimes it felt as though there were competing interests. Actually now, every single one of us wants to be able to do our shopping and go home and not have picked up a virus for ourselves or our families. So we've suddenly got a huge amount in common that we can draw together with, and community councils must be at the heart of that.
I agree,
absolutely.
Irene.
I know from I'm going to come to you in the closing thing here, Daisy. So I know from my own experience working in council spheres with community councils, they are fantastic ambassadors for spreading the news and for clarity within a community or over something like this, and being able to go out and get that message across wherever they can. And that will be an online, but we're all embracing online at the moment, or we wouldn't be here today. Daisy, I was going to pass over to you to close, but with a question that we've also had, which I think is a different scale. We were talking about national and local working together. What about enabling more active travel and cycling from those outlying areas into towns and small towns and villages to help those that are in more outlying areas? So I wondered if you'd have thoughts about that, or
yes, absolutely. Yeah, thank you, Irene. I think just to pick up on the points that Leslie and Anna were making there as well, I did talk about national, local and third sector, but what I didn't talk about was the power of the civic voices that have come forward over the past 2 or 3 weeks. And we talked about being inundated by tweets and social media and messages. And that is the power of civic voice and community voices that have come together demanding this to happen, which is why things have happened so quickly, I think. Active travel organizations, there's like the bids were there to support, there are other organizations to come help support. So I think, I completely agree. And I think there's we're all facing one common kind of threat. And to see everyone come together, national, local, civic, come together is important, and it's what is needed going forward. Yeah, it's a good question about outlying areas coming in and traveling, which is one of the reasons why I think it's really important for us to work regionally. You work neighborhood level and locally, and there's a national piece of work that is policy and unlocking some of the barriers and things. But the regional perspective of how you can start to bring in people from Musselburgh, for example, into Edinburgh when things start to ease up, or conversations you're having with the community council in Midlothian, for example. So traffic calming, reduction of speeds, potentially some of the things we're talking about. But I think there's a really good conversation to be had with regional transport partnerships and local authorities on how to bring those two things together, and how the commutes can get once the commuting or going to school happens again. I think there is a regional piece that needs to come into the mix as well.
Okay, thank you. I'm going to bring things to a close now. We have had a lot of other questions about other topics. As I said, all those have submitted your questions, thank you very much, and we will be looking at them. I suspect there's a whole other session in them, because there's a lot of questions around public transport and what happens when things relax, and how do we support public transport. A very good question indeed. So it may be that we meet again and have another conversation at some point. We'll go through those questions and review them. As I say, there'll be a recording sent out to everyone who signed up, irrespective of whether they managed to stay on the call or whether they perhaps missed the call or had to leave early. That will be sent out in the next couple of days. So we will be in touch with everyone. So what I'm going to do really is just to thank Daisy, Anna and Leslie for taking part, for being up there. But as I started to say how many hundreds the number of sign-ups had increased with every day. But it's a sign of that community cohesion around wanting to be safe as we go out, and wanting us all to have an equal opportunity to be safe. And I think that's fantastic. I hope what we've done is put a countrywide message out there as to what's available, and for everyone to be able to take that up. And that locally, please, feed in your local issues locally, because that's where it can be of value. So if we've achieved that small task, then I'll be happy with that. Thank everybody for listening in. Thank Christopher in the background for organising all of us. He's done a fantastic job in setting it up as well. So thank you very much, everyone, and keep safe. Bye-bye.